This course will assist employers in making reopening decisions during the COVID-19 pandemic, especially to protect vulnerable workers and others that your employees may come into contact with. It is important to check with state and local health officials and other partners to determine the most appropriate actions while adjusting to meet the unique needs and circumstances of the local community. By the end of this course, you will be able to determine if you should reopen your business. You should ask yourself the following questions before deciding to reopen your business. Will reopening be consistent with applicable state and local orders? Are you ready to protect employees at higher risk for severe illness? Based on what we know now, those at high risk for severe illness from COVID-19 are people 65 years and older, people who live in a nursing home or long-term care facility, people of all ages with underlying medical problems, particularly if not well controlled, including conditions such as chronic lung disease or moderate to severe asthma, serious heart conditions, severe obesity, a body mass index or BMI of 40 or higher, diabetes, chronic kidney disease undergoing dialysis, liver disease, and those who are immunocompromised. Many conditions can cause a person to be immunocompromised, including cancer treatment, smoking, bone marrow or organ transplantation, immune deficiencies, poorly controlled HIV or AIDS, and prolonged use of corticosteroids and other immune-weakening medications. Before you may consider opening your business, you must ensure you have plans in place to protect these and all of your employees and are in compliance with state and local orders. If reopening is not consistent with applicable state and local orders, and if you are not ready to protect employees at higher risk for severe illnesses, then you should not reopen your business. If you plan to reopen your business, you must ensure you have or are able to implement recommended health and safety actions. You must promote healthy hygiene practices such as hand washing and employees wearing a cloth face covering as feasible. Frequent hand washing. Employees should wash their hands often with soap and water for at least 20 seconds, especially after you have been in a public place. You should also always wash your hands after blowing your nose, coughing, or sneezing. If soap and water are not readily available, a hand sanitizer that contains at least 60% alcohol can be used. Cover all surfaces of the hands and rub them together until they feel dry. Avoid touching eyes, nose, and mouth with unwashed hands. Use of cloth face cover over mouth and nose when around others. You and your employees could spread COVID-19 to others even if no one feels sick. The cloth face cover is meant to protect other people in case you are infected. Promote the use of a cloth face cover as feasible. Continue to keep about 6 feet between yourself and others and ensure others in your business are able to do so as well. The cloth face cover is not a substitute for social distancing. Intensify cleaning, disinfection, and ventilation. Clean and disinfect frequently touched surfaces daily. This includes tables, door handles, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, sinks, elevator buttons, and equipment. If surfaces are dirty, clean them. Use detergent or soap and water prior to disinfection. Then, use a household disinfectant. Most common EPA-registered household disinfectants will work. Encourage social distancing and enhance spacing between employees, including through physical barriers, changing layout of workspaces, encouraging telework, closing or limiting access to communal spaces, staggering shifts and breaks, and limiting large events when and where feasible. Consider modifying travel and commuting practices. Promote telework for employees who do not live in the local area if feasible. Train all employees on health and safety protocols. If you have not implemented these actions, then you must address and meet these safeguards before considering reopening your business. You must also ensure you have or are able to develop and implement procedures to check for signs and symptoms of employees daily upon arrival as feasible. Symptoms may appear 2 to 14 days after exposure to the virus. People with these symptoms may have COVID-19. Cough, shortness of breath or difficulty breathing, fever, chills, muscle pain, sore throat, new loss of taste or smell. This does not include all possible symptoms. Other, less common symptoms have been reported, including gastrointestinal symptoms like nausea, vomiting, or diarrhea. In addition, encourage anyone who is sick to stay home. Create a plan for what to do if an employee gets sick. Regularly communicate and monitor developments with local authorities and employees. Monitor employee absences and have flexible leave policies and practices. Be ready to consult with the local health authorities if there are any cases in the facility or an increase in cases in the local area. If you have not implemented these actions, then you must address and meet these safeguards before considering reopening your business. This course was designed to assist employers in making reopening decisions during the COVID-19 pandemic, especially to protect vulnerable workers and others that your employee may come into contact with in the course of their work on site. Remember, it is important to check with state and local health officials and other partners to determine the most appropriate actions while adjusting to meet the unique needs and circumstances of the local community. If you are unable to implement all of the action items discussed in this course, then you should address each and ensure safeguards are in place before reopening your business. If you are able to take actions identified in this course and are in compliance with all other requirements specifically outlined for your business by your state and local government, then you are ready to consider opening and monitoring your workplace.